Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I want to talk about blood work and how it relates to pain, sort of chronic pain, and performance. So I want you to picture two patients. Let's just say they have the same injury. Let's just call it a meniscus tear or something like that. And they're the same age. Both had imaging. They had the same results. They go to physical therapy, see the same therapist, do the same exact program, and one of them gets better in a couple weeks. The other one takes closer to 3 months. There's a lot of reasons why that may happen, like sleep, for example, is your body's way of recovering. So if one is not sleeping, that would definitely be the cause. But let's just say the sleep is identical too. So this is very hypothetical. Well, the answer will oftentimes be found in their blood work. But let me start off by saying that not all blood work is created equal. So conventional blood work, the ranges, they're there to catch problems when they already exist, whereas functional medicine tightens the windows, so it's less lenient and will catch things before they become bigger problems. An easier way to say that is conventional lab ranges are there to capture or detect disease, not dysfunction. The other problem is conventional blood work tends to be sort of bare bones. They do just what they need to do or what insurance will cover. That's where a comprehensive blood work approach can be much more eye-opening, catch things. It casts a bigger net in a sense. So I'm going to go over 10 markers that I think are pretty important to ask for. And I did create a whole cheat sheet around this that you can download. I'll put the link in the show notes as a free download. And it's something you can take to your provider and say, hey, would you be willing to test these things? Okay, so number one, this one is usually standard in most labs. That's CRP, which is a high sensitivity C-reactive protein. It's the gold standard marker for inflammation. So elevated levels will correlate with more pain and slower healing times. There's like low-grade swelling that just sits there, or systemic swelling or inflammation. That can trigger into chronic pain, which becomes a whole nasty thing to deal with. It's a hard thing to shake that's basically when your nervous system becomes overly sensitized. Next, I'd get an ESR, or what's called a SED rate. That is a measure of inflammation over time. So that helps differentiate between acute injury from systemic inflammation. So if you've got high ESR and high CRP, that's basically an inflammatory storm. Next is insulin. I think this one should be standard all blood work. We have a glucose-centered paradigm when it comes to blood sugars. We know elevated blood sugars and diabetes delay wound healing, tissue healing. So insulin is usually the first shoe to drop. So insulin goes high first, but you could still have normal blood sugars. So that's the first sign that you're becoming insulin resistant. Basically what's happening is insulin's trying to push the sugar out of your bloodstream, and then once your cells stop responding to it, it starts to push more insulin out. So that number goes up first. Okay, next on the list is vitamin D, a super common deficiency, especially if you live north of Georgia, because you get a lot of vitamin D from the sun. Or even here in Florida, where people just lather up in sunscreen and just avoid sun like it is cancer, which is a whole other topic. So it's actually common even in Florida to have vitamin D deficiency. Vitamin D is a modulator of your immune system. And we do know that low vitamin D is linked to chronic pain, especially back and muscle pain. You really want to be, between 40 and 60. 40 is definitely on the low side for that one, by the way. Next on the list are omega-3s. So you've got your omega-3s, which is your saturated fats, and your omega-6s is your unsaturated. So there's a ratio that is ideal. And unfortunately, because of food supply and a lot of the industrial seed oils that are out there, we tend to be low in 3 and high in 6. And that puts you into a pro-inflammatory state. Next, we got homocysteine. Homocysteine combines with B12 in the methylation cycle. So if you're elevated in your homocysteine, it may be a marker for poor methylation. This can lead to vascular inflammation. And then high levels of homocysteine have been correlated to things like migraines, tendon pain, and fatigue. Then I would suggest a full thyroid panel. A lot of panels just test for TSH, thyroid stimulating hormone. That alone is kind of a useless marker. You really want to do your TSH plus free T3, free T4, TPO antibodies. There's more, but those are sort of a bare minimum. So if you have poor thyroid conversion, that's going to turn into low energy and weaker healing. The TPO is good to get because that's a sign of like Hashimoto's or autoimmune condition that attacks the thyroid. When you have autoimmune dysregulation, that can cause systemic inflammation and inhibit wound healing. Also, testosterone should be checked. Yes, for men and women. Women do have testosterone. And low testosterone, it's becoming a global issue, mostly because of microplastics. That's a known hormone disruptor, particularly for testosterone. And that will obviously cause muscle weakness, poor recovery. You'll have mood instability, and then it will also increase your pain sensitivity. Next, you'd want to check your cortisol levels. Ideally, you have at least an AM and a PM one. So cortisol is a tricky one, and it confuses a lot of people because people think cortisol equals inflammation. It's actually not true. Cortisol is a strong anti-inflammatory. When you are in a fight or flight state, your body decides to downregulate certain systems and upregulate other ones. So it does push cortisol into the bloodstream, which then releases sugar into the bloodstream for quick energy for an emergency situation. That's a good thing. And it downregulates your nervous system, your immune system, sorry. So because of that, it actually decreases inflammation. But what happens is when people are in a chronic state of stress, aka in a painful state, they're constantly spiking their cortisol. So what's supposed to happen is you get up in the morning, you see the sun, that tells your body it's time to get up and start moving. So cortisol is now released. So cortisol should be highest in the morning and then descend throughout the day because it's the opposite hormone to melatonin. So as it descends, melatonin should rise, which will let you go to bed. A lot of people will have a flat line for cortisol from chronically spiking. It's like a cortisol resistance in a sense. Or you'll see an opposite pattern where it starts low and it elevates through the day. So if you're having difficulty falling asleep, that's a sign that your cortisol is elevated in the evening. So it's a good idea to get at least an AM, PM. There's something called a Dutch test, which will tease us out even further, to get an idea of what your daily pattern looks like. Now, I definitely would suggest the regular CMP and CBC. That's the comprehensive metabolic panel and the comprehensive blood count. That's pretty standard. But what you want to look at are several other markers in there. You want to look at your liver enzymes, so ALT, AST, and GGT. All right. If you have elevated enzymes, it's a sign of liver stress, and that's going to inhibit your detoxification. You want to look at your MCV. That means your mean corpuscular volume. This is what I spoke about at length. That's the average size of your blood cells. So blood cells start off when they're young. They start off large, and as they age, they get smaller. And there is a variance in the lifespan of a blood cell. It's something like 120 days, I think, is average. And then it can vary from like 88 days to a little more than 122. And so, in other words, MCV is an inverse marker. So if your average size of your blood cells is elevated, that's a sign that your blood cells are dying sooner. And this could be also related to B12, so definitely look at your B12 and folate. There's a correlation between those things. Then you want to look at your platelets. That's a sign of inflammation and clotting. And your albumin. So if your albumin is low, it's a sign of a poor nutritional status. So let's just look at an example. So let's say you have a tendinopathy, really common, like an Achilles tendinopathy, and it's taking forever to heal. Tendons do take a long time in general just because of poor blood supply. But if you find you have a high CRP, that's the gold standard marker for inflammation, that may be a sign that you have poor collagen remodeling. If you have low vitamin D on your panel, that also will impair your tendon healing. And then same thing with high insulin, which means it's going to be poor healing. You'll probably have a chronic low-grade inflammation. We also know that with like low back pain, a typical pattern we'll see is low testosterone, low vitamin D, and high homocysteine. Those will all correlate with slower healing of the spine. And then let's say like you have poor muscle recovery, you get sore, and it lasts a lot longer than 2 days. A typical pattern there would be low omega-3 and some sort of thyroid dysfunction, which will dramatically slow down the tissue repair. So to sum this all up, download the cheat sheet, bring that to your provider, see if they're willing to test all that. It's easier these days to get blood work, by the way. So there are lots of people who can order it. If you go outside of insurance, you may be able to do it these days on your own. You just have to pay for it. But just remember that the pain isn't random and recovery isn't random. Your blood chemistry tells the story. And when you understand that story, the healing isn't a mystery anymore. So if you like this episode and you have questions, please reach out to me, chris@dynamicnaples.com, and I'll be talking to you soon. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.